right, so a brief discussion on Achilles tendinitis and inflammation. So if you learned in chapter 1, when people have chronic long-term pain in their Achilles tendon, it's most of the time due to a condition called tendinosis. And we know this based on studies where chronic Achilles pain sufferers have ended up having the surgery. A piece of their Achilles tendon was removed and examined under a microscope later, and no inflammation can be found in the tendon. While some readers may find this hard to believe, there's actually been a lot of studies showing that it's true. For instance, so these are biopsy studies done, like at surgery, where they take people and they take actually a piece of the tendon out. They look at it under a microscope, and it says these studies here, basically they found no inflammation, no inflammatory cells. So, and if there is inflammation in there, you'd be able to find some inflammatory cells, which they just don't find from these biopsy studies. But while there is normally no inflammation to be found in the tendon of people with long-term Achilles tendon pain, what researchers have found are signs of failed healing, such as disrupted and disorganized collagen fibers. Collagen is a main ingredient that makes up your connective tissues, and it's having a hard time coming together properly in the tendon. They also find vascular proliferation or neovascularization. Lots of blood vessels arranged in irregular patterns are found in the area, a sign that tendon healing is trying to take place. So recall the pictures of microscopic tendon tissue that we saw in chapter 1. Here's what a normal Achilles tendon looks like up close. Okay? See how straight and organized the tendon fibers are? That's the way things are supposed to be. Now check out the other drawing. Here's a microscopic view of what Achilles tendon fibers look like when one has tendinosis. Okay, they don't call it tendinitis because there's no inflammation, which is what the itis means. So really, it's not really Achilles tendinitis, it's Achilles tendinosis. Note the wavy, disorganized appearance of the fibers. Wow, what a difference. And that's what your tendon looks like when you have Achilles tendinosis. Looks a little different from the first one, doesn't it? What a mess. As you can tell, there's a lot of disorganization going on here. Your body is trying to repair itself, but can't quite get its act together. So there you go.